Ladies and gentlemen, friends from the media, good afternoon. Welcome to today's briefing. Since the epidemic broke out, China is waging a united battle against it with the most comprehensive, rigorous, and thorough measures. Thanks to these arduous efforts, China has produced visible progress. Recently, my colleagues and I received a lot of questions and interview requirements concerning on China's treatment work on COVID-19. In order to help you have a better understanding, today we invite 4 experts who participate in the frontline treatment work in Wuhan. Let me present you. Professor and Dr. Du Bin, Director of Medical ICU, Peking Union Medical College Hospital. Ms. Qiao Jie, academician of the Chinese Academy of Engineering, President of Peking University Third Hospital. Mr. Cao Bin, Vice President of China-Japan Friendship Hospital. Mr. Li Haichao, Vice President of Peking University First Hospital. In today's briefing, we set up special arrangements for foreign correspondents in Beijing to ask questions to the experts in Wuhan while 5G connected telecommunications. And the entire session will be conducted in English. Now we will open from short introductions by the experts. First, let us invite Professor and Dr. Du Bin, please.
Good afternoon, ladies and gentlemen. I am Dr. Du Bin, or Bin Du, as you like. I'm from the Peking Union Medical College Hospital. I came here in Wuhan on January the 18th and has been working here since then. As a member of the national expert team, the responsibility of my colleagues and I is to review every individual cases who are critically ill with COVID-19, and we will discuss about treatment plan with the treating physicians, as well as to provide feedback and suggestions to the local and national healthcare authorities about the treatment strategy and other coping strategies to fight against the COVID-19. Thank you.
Thank you, Professor Du. Next, let's invite Ms. Qiao Jie, please.
I'm Professor Qiao Jie from the Peking University Third Hospital. Peking University Third Hospital is one of the top university hospital and also a public hospital directly under the National Health Commission of China. And noon of February 1st, I received the instruction to come to Wuhan as soon as possible. And I left Beijing and arrived Wuhan at 9 p.m. that day. Actually, as leader of this special task team, my responsibility is to organize the doctor, nurse, and supporting professional to establish the new ICU ward. And one day later, February 3rd, we just successfully completed prepare work and ready to serve and saving life. we try our every effort to increase the treatment rate and cure rate and reduce the rate of infection and mortality for the severe COVID-19 patients. And for this mission, we, together with the Peking University member from the top 3 ranking comprehensive hospital, together I'm the chief responsible for that, including the member 90 doctors and 360 nurses. And our provided service on the Tongji Hospital, Sino-French New Town branch, with more than 11,000 beds treatment for the severe COVID-19 patients. And as you're aware, I'm also a director of a National Quality Control and Safetyness Center of Obstetrics. So I also have a responsible for the survey of the infection pregnant women and also guarantee the delivery procedure and to prevent the mother and baby vertical transmission. So I'm here and ready for answer the question. Thank you.
Thank you very much, Professor Qiao. And Professor Cao Bing, it's your turn.
Thank you. Good afternoon. My name is Cao Bing. I'm a primary physician, and my major is respiratory tract infections. During the last 20 years, I have experienced SARS, pandemic H1N1, human infections caused by H5N1 and H7N9. We also had cases of adenovirus pneumonia, and today we have another coronavirus infection, COVID-19. I have been working in Wuhan for about two months. I'm proud to be a doctor and a researcher working with my colleagues during the last 2 months. We have left our family, but we are honored. We have been working day and night, but we are honored. We are honored because we can help. China has encountered many disasters during long history. Again, I'm sure we can overcome this coronavirus pneumonia, just we have done during the last days. I will share with everyone a poem. The poem was written about 3,000 years ago, and I believe that everyone in the room, everyone in Wuhan, everyone in China is moved and motivated by the poem. The poem is actually a battle song. 无一，岂曰无一，与子同胞。王与兴师，修我戈矛，与子同仇。岂曰无一，与子同责。王与兴师，修我矛戟，与子协作。岂曰无一，与子同伤。王与同师，修我甲兵，与子偕行。The poem is named that if you have no cloth. If you have, I will give you the brief translation. If you have no clothes, my brother, I will share with you. If you have no food, my brother, I will share with you. If you have problem, if you have illness, my brother, I will be always together with you. Today, I will salute to every nurse and every doctor for your contribution, and especially for those who lose their lives. Thank you.
Thank you very much, Professor Cao Bing. I'm sure your words represents what most and all of the doctors want to speak it out. So thank you very much.
Thank you.
Lastly, Professor Li Haichao, please.
Good afternoon, ladies and gentlemen. I'm Dr. Li Haichao from Peking University First Hospital. I arrived in Wuhan together with the third batch of a medical team from Peking University. And I joined my colleagues who came here earlier, and I was responsible for the critical ill patient in the ward of Tongji Hospital. I had worked with Professor Chao in the same buildings. And I am a pulmonologist, and I have taken part in the SARS treatment in Beijing during 2004. So I believe because of my specialty and my experience of SARS, it may be helpful for me to against the new coronavirus. The team of our hospital consists of 135 members. Among them, 30 are doctors that came from the respiratory and critical care medicine, intensive care medicine, and some other discipline of internal medicine, and also thoracic surgeon and infectious disease. We have 2 experts of infection control and 1 staff in charge of logistic supporting and communication. And we have 102 nurses. Some of them have a very good experience in the intensive care unit, both of respiratory and surgical. Till now, we have admitted 63 patients in our new ward. Fortunately, most of them have been discharged. Today, we have 10 patients left in our ward, and all of them are in the recovering period. I believe that they will be discharged in the near future. So I'm very glad to be here to share my understanding about the COVID-19 and my experience here. Thank you.
Thank you very much, Professor Li, and great thanks to all the experts. Especially, thank you for what you have done for the patients here, and also what you have done for the people. So now the floor is open for the questions. May I remind, please identify yourself before raising questions. And please speak clearly and slowly, because we are 1,000 kilometers away. Okay, please raise your hands. Okay, the gentleman in the first line, in the blue shirt.
Thank you. Question from Reuters. Actually, 2 questions. First, how many cases are there of people in Hubei who recovered and then later were diagnosed with the virus again? Is there a chance that this will keep recurring? And my second question, last month, a 70-year-old man in Shenongjia was tested positive for the virus. He visited his sister in January, but did not show any symptoms until 27 days later. How should we deal with such cases that have long incubation periods? And how many of such people are there? Thank you.
Okay,
Well,
Professor Du.
hello, doctor. Thank you, Mr. Thank you for your questions. And the second question comes first. And dealing with the patient in Shenongjia, actually, I have no idea of how this patient behaves and what is the case, what details of the case. But however, I would rather translate your question as the long incubation period, which has not been reported, has not been discovered, either here in Wuhan or in Hubei, or in other provinces or other countries. And from most of the publications right now, we understand that the median incubation period is 5 to 7 days. And with the longest incubation period as 14 days. And there's no data showing that even longer incubation period ever exists. And for your first question, yes, the answer is yes. There are several cases who has been reported as, had a positive test for RNA of the novel coronavirus after being discharged or after multiple negative results. And we know that these cases exist in Hubei, in Wuhan as well, but currently we have no idea how many of them. And more importantly, according to the current publication, the current research results, that there's no evidence of these patients after being positive again. For the coronavirus RNA, they have the ability to transmit the virus to other people or to their own, close contacts. There's no evidence. Thank you.
Okay, next question, please. Okay, the gentleman in the middle area in the black suit. Second row, in the middle area.
Thank you. I'm from CGTN, China Global Television Network. So my question is, it has been 2 months since the coronavirus was first reported in China, and we know that since then, a lot of measures have been taken by the government to contain its spread across the country. Now, looking back, what kind of lessons can we draw from this fight against the disease? Thank you.
Okay. Thank you for the question. Actually, in my opinion, it's very important things is 2 key points. One is for the mobilizing all resources, and second is the diagnosis, control the disease scientifically. In terms of mobilizing the all resources, actually not only the medical person, doctor, nurse, but also the social worker and the logistic staff, and special for the construction workers on, all is important, like establish the mobile cabin hospital. It's really amazing because can treat a more mild patient because most of our patients is mild and need to isolate it and observe the changing condition. If change from mild to severe, can transfer to our side because our task is treatment for the severe patients. And we are happy for the training and discharging some patients back to home and back to health. And some severe patients become mild, but also some pass away because we need time to realize the mechanism of this virus infection. And also we already established the different treatment like the oxygen giving and use non-invasive Valentine something, and also try to use some drugs and other treatment, but we need time to survey for that. So we organize the specialists together and even the remote consultant for improve the treatment result. So it's, we need scientific control of the disease. And thank you.
Okay, Professor So.
Okay, thank you. I think it's a good question, yes. In no more than 2 months, the disease, because COVID-19 is not only a Wuhan disease, and it's not only a China disease, but it's also a global disease. So, so the question is what lessons? But I want to say that what achievement the China doctors and the China scientists made. during the last 2 months, not so many days. I think the most achievement is that the first is the science. Yes, if we want to control the disease, we have based on science. And the science, I believe that many doctors and researchers, scientists in Wuhan and in other cities of China contributed a lot to the knowledge of the new disease. So everyone have to remember that it's a new disease. If we have a new disease, it takes time for us to get to know the disease. And we get to know the disease for several steps. First step is that the doctors to collect the clinical data, the clinical signs, the laboratory findings, and the chest X-ray and the CT scans. This is the first step. And the second step is the pathology. And the good news that the pathologist in Wuhan City has done autopsy. And the pathology data help the clinicians to know more about the disease. And third is the basic science. So it's the first time that the Chinese scientists find the cause of the disease. We look back to the end of December. Nobody knows what the disease is. And because the disease is viral pneumonia with the known cause. But now we have the cause of disease. The disease is caused by a novel coronavirus, and now is named by the International Society as SARS-CoV-2. And the disease, we call that COVID-19. I think it's the first achievement of the China made during the last 2 months. And second is that is the openness of the Chinese government. From the very beginning, the China government have face-to-face connection with the WHO. And I'm the person to introduce our clinical findings from the first cohort of the cases. And I also got email from the foreign physicians. They know, and we got to know for many years. They told me that, Cao Bin, I got to know the disease through your publication. And I helped them. For example, I helped the American doctors to publish the first paper in Blue Journal. And in Blue Journal, they introduced to the American citizens what the disease is like. I think it is what we have done during the last 2 months. Thank you.
Okay. Professor Li Haichao, would you like to add some words?
The tasks for our teams is to treat the critical ill patient. So my experience is the following aspect. The first one, we must set up the multiple discipline teams because it's a very severe pneumonia and it can develop to be ARDS. And the severity situation needs multiple discipline doctors to treat the different situations. And the second one is that to keep the oxygen supplement is very important. So the oxygen therapy and the rational use of ventilators is very important. And the third one, I think, just as Professor Cao said, it's a new disease. So in these areas, we set up a mechanism for sharing knowledge and experience between the colleagues from the different areas. So it's very helpful for us to know about this disease. Thank you.
Okay, Professor Du, anything to share with us?
Well, it's a very difficult and tough question for me because there are too many things and too little time to think about it. But however, if I could have the chance to go back, I would say I will try more aggressively the invasive mechanical ventilation in all patients with clinical deterioration in terms of the respiratory failure or hypoxemia. And in addition, I will try more aggressively to propose my suggestion to the local and national healthcare authorities in order to convene all the my ICU colleagues, including the doctors and nurses, to work together in some designated hospitals to establish a intensive care unit to cope with the critical care surge or the surge of the critically ill patients. And I do believe such kind of the measurements or approach can help our patients, especially those critically ill patients, to recover more rapidly. Thank you.
Okay,
Yeah,
want to
actually,
add
this
some
time,
words?
gave
Sure.
us many lessons to learn. Yeah, actually, not only ICU, not only the respiratory tract disease. Actually, some patients have the underlying disease complicated, like vascular disease, hypertension, diabetes, and also kidney failure, something. So we need to combine together the specialists to treatment this complicated condition.
Okay, thank you. Next question, please. Okay, the gentleman in the first line in black shirts. Yes. Yes, first line, right. Yes.
Hi, from the Hindustan Times newspaper. In the last couple of days, there have been a spike in cases in India. Keeping in mind that both India and China have similarly densely populated cities and regions, what advice would the doctors have for their colleagues back in India, the health authorities who are looking into this? How can this, be tackled and stop from being escalating into an epidemic in India?
Thank you for the question. Yeah, actually, China and India is the two most important countries in Asia, and we have some similarities. Aspect like the large population and habits of people together with family activity, and also the medical system and the technique there is some room to improve. And so I think we have something can share. And in my experience as the hospital treatment, actually, we have enough the medical staff face to the infection disease. Most of staff know or lack the experience for treatment the infection disease combined together with the pneumonia and other complicated cases. Complex condition. So first, need to training more medical staff for facing this special COVID-19 disease, mild and severe, and different side to training, and also how to protect themselves, even the protecting clothing put on and take off also need to educate, training. And the other thing is for the equipment, need to prepare first, like the invasive, non-invasive, something. Yeah, this always need the treatment, the different disease, need more equipment to prepare first. And the third thing is for the room prepare, like the negative pressure ward. It's difficult to changing completely, but can practically use the high power exhausted fan in the ward, can changing the airflow and safety for the patient and for the medical doctor and nurse. Another is for the training for the community population. Even wear the mask and wash the hand. Also need to step-by-step training can isolate the disease epidemic. It's all very important. Thank you.
Okay. Next question. Okay, the middle area, the gentleman in the fourth line. Yeah, in the fourth line. The middle area. On the right side. Okay, yeah. Yeah, actually, it's maybe the Japanese one first, then
Okay.
another one later. Okay.
Sorry.
Yes.
Hello, I'm from TBS, Japanese TV station. I'm sorry, I have 3 questions. First one is, unfortunately, doctors in Wuhan passed away, even though some of them are very young. How would you analyze the reason? Second one is, it's been reported in Japan that infection in the hospital is occurring some places. With your experience, how do you prevent the infection in hospital? Third one is, if you have experience to cure SARS patients, is there any difference between coronavirus and SARS? Thank you very much. 谢谢你。
I'll take the first 2 questions and leave the last one to my colleague, Dr. Li. And as to your first question, yes, we know that among all the non-survivors of COVID-19, that although most of them are elderly people, that there are some younger deaths, and including doctors and general public. And we know that although they are not elderly, which is a well-recognized risk factor, but some of them, if not all, do have some comorbidities or underlying diseases, such as hypertension and diabetes, which are very common even among the younger generation in China, according to the previous studies. And moreover, as I mentioned before to the last question, that the unnecessary prolongation of the non-invasive mechanical ventilation, as well as prolonged or long-term high-dose corticosteroids are, in my mind, are the major reason of death in this younger generation, because there are more harms than benefits, such as the nosocomial infection, such as the weakness, such as the biotrauma or hyperglycemia, etc. As you second question concerning with the infection control within the hospital, I think the key word is plan. You must have plan. For hospitals in Japan, I would say you must have plan for every suspected patient that going to fever clinic, going to the general outpatient clinic, or even inpatient department. And you must have plan that how to detect the suspected cases according to the clinical manifestations, to the laboratory tests such as lymphopenia, or according to the CT scan, as mentioned by Dr. Cao. And you must have the ability for laboratory confirmation for those suspected cases. And you must have plan to isolate individual suspected cases before confirming or rule out the diagnosis. You must have plan to educate and train healthcare workers within individual hospitals to prepare themselves for the cases. And you must have plan to prepare not only space, but also supplies, such as personal protection equipments for all the healthcare workers involved or who may encounter the suspected cases. Thank you.
Thank you for the question. Yes, your third question is that what the difference between SARS and this new coronavirus. So I will start from the similarity. Both SARS and this new virus belong to the family of coronavirus. So from the genomic sequencing analysis, we can find that both viruses share about 78% of similarity between the two viruses. And when we look at the clinical features of the two diseases, SARS and COVID-19, that both of the viruses can mainly cause pneumonia. And when we look at the pneumonia, the similarity is there. They are both viral pneumonia, which means that when we look at the chest CT scan, both diseases cause the ground glass opacity of both lungs. This is the similarity. And when we look at the clinical features and laboratory findings, both diseases have the common features, such as the normal white blood cells, and more commonly, we find the lymphopenia and the increased liver enzyme, or some of them may develop sepsis. So when we look at the similarity, you may find that the SARS is so similar as to COVID-19, but there's a difference between the two viruses, and there's a difference between the two diseases. First, let's look at the mortality. And for SARS, the mortality is around about 10, but if you look at the COVID-19, if we look at the cases outside Hubei Province, the mortality is less than 1%. Even we look at the mortality in Hubei Province, the number is around 3 to 4%. So it seems that COVID-19 is less severe compared with SARS. But the bad news is that COVID-19 is easily transmitted. And when we look at the documented cases between SARS and COVID-19, we can easily find that the new virus is more successful compared with SARS virus. And all of us know that you are from Japan. And I don't know the exact number of the confirmed cases in Japan, but I learned that in Korea, the case number is over 3,000. And there are a rapid increase of the cases in Europe, including Italy, Spain, and Germany. And also we find that in the Middle East, such as Iran. So you can find that the COVID-19 is more widely distributed around the world. And when we look at the pathology, and when we look at the mechanism of the disease, it seems that the SARS-CoV-2 virus can easily invade the lung, easily invade the other organs, including the heart, including the liver, intestine. So this new virus is really a threat to human beings. So nobody knows that what the disease will spread in other areas of the world. But I believe that doctors, researchers, scientists all over the world should work together to fight against this new disease. The war is not over. Thank you.
Okay, Professor Li. Yeah.
Yes, the question is about the SARS and the COVID-19. I have very deep memories about the SARS, which is 16 years before. I worked in a hospital in the suburb area of Beijing, and we have 124 beds in the area, and I have 6 ICU beds. And to my opinion, that there are some difference between the COVID-19 from SARS. Now, in our world, most of the people is above 60-year-old, and some of them, a few, are above 50-year-old. A few is a young person, but in during the SARS period in the world, there are a lot of young persons. So the characteristic of the COVID-19 is the people is more older than the SARS. And the second characteristic is that some of the COVID-19 patient is very severe because they are a lot of middle age and old people. They have comorbidities, and they have a very severe hypoxemia and badly ARDS. So a lot of them need a long time for the non-invasive ventilation and or mechanical ventilation. And also the patient have a lot of comorbidities, such as just Du and mentioned, it's hypertension, coronary heart disease, and the COPD, and hypertension, diabetes, so many diseases. And also they have a very common for the disorder of electrolytes and the imbalance of basic acid. So there are so many problems that you must face. It's very severe. And the third characteristic is, I call it, it's slow. The first is that some of them have a very slow onset. They maybe have a mild fever or mild symptoms of respiratory tract, such as a mild cough and dyspnea. But 10 days later, or maybe more than 2 weeks, the patient have an exacerbation. It's the situation become bad rapidly. So it's manifested as onset is slow, but exacerbation is quick. And another slow is that some situation, some patients have a very good situation be controlled, but they still have a exertional dyspnea. When they take some exercises, the saturation of oxygen could be decreased rapidly. So they need a long time to recovery. Maybe I think it's due to they are older persons and with some comorbidity disease. So it's very important to care about the patient with hypoxemia, because you don't know very exactly about when and how they could be exacerbated. So you must keep a close observation on the symptoms and the saturation of oxygen, and also CT scan and some other factors about the inflammation. So if the situation become bad, you must pay much attention on them. Thank you.
Okay, next question. Yes, the gentleman in the fourth line in the middle area, it's your turn to raise a question. Just now, you already have the mic. Yes.
Yes, thank you. Thank you very much. From the Wall Street Journal. First, a question for Mr. Cao Bin. You co-wrote a study that was published in the Lancet Medical Journal, which gave December 1st as the date for the symptoms onset in the earliest recorded case. As I'm sure you know, the Wuhan government has said that December 8th was the date for symptoms onset in the first confirmed case, and a few other studies have also cited December 8th. I was wondering if you could just clarify the difference between those dates. Is it that the December 1st case was just clinically diagnosed and not confirmed? And then a second question for all of you. I wanted to ask what you had been able to learn from the samples that were taken from the Huanan market early on. And is it correct that some of that evidence was lost when the wild animals and the meat from them was destroyed at the time when the market was closed? Thank you.
Thank you for your question. Yes, I appreciate your interest in our paper published in Lancet. The paper published in January 24th, on the day of Spring Festival. Yes, many foreign doctors told me that they got to know the disease through our publication in Lancet. Because in this paper, we introduce the clinical features of the first 41 cases hospitalized during the months of December and early January. I'm a primary physician. Yes, my job is to collect clinical data, and I think the job is why we collected the clinical data. Yes, the aim of our job is to have the first version of clinical treatment guideline of this new disease. At that time, the first version, when we wrote the first version of the guideline, we used the name of viral pneumonia with unknown reason. But after that, maybe you have already know that the China have published the 7th version of the guideline. But the serial guideline was based on our first line observation and the collections of the clinical data, laboratory findings, chest X-ray and the CT scan. So when we collected the clinical data for the onset of symptom, it is the patient self-reported. So from our cohort, yes, and I have double-checked my database that the patient recalled that he had illness on December 1st. So I'm not sure, yes, we are talking about the same case. But for new disease, it will, as I have mentioned, that it will take many days as far as to get to know their illness, including the incubation, including the severity of illness, and including the optimal treatment choice. So there are many angles to answer a scientific question. Yeah. So I'm a clinician. I'm a primary physician. Yes. This is what I can tell. But I would like, yes, to introduce more of our research in the future. Thank you.
Okay, the second question, Professor Du would like to give an answer. Yes.
Sure. Thank you for your question. For your second question, which concerned with the closing of the Huanan seafood market. And as far as I know, the decision to close the Huanan seafood market is based on the clinical information, such as those provided by Professor Cao just now, that in the initial cohort of the patients, that at least 60% of them had a history of contact or visit with the seafood market. And as far as I understood, that the decision to close the seafood market goes along with the evidence, although subsequently find it, that I think CDC staff have found that the animals, the wildlife in the seafood market have got a positive test with regards to the RNA of the novel coronavirus. I'm not aware of any evidence to show that if they keep all the meats or all the animals within the market, or if the sum of them has been destroyed or not. I think you'd better have if you have the chance, you'd better go to the government to have more detailed information. Thank you.
Okay, because time is limited, let's give the very two last chance to raise questions. One to foreign journalists, another one is to our Chinese journalist. So yeah, the lady, you stand up. Okay, you have the chance.
Thank you, Debbie Edward from ITV News. How confident are you that China has turned a corner in its battle against the coronavirus? And is it still possible that we could see another spike? And secondly, I know you've answered a couple of questions on this nature already, but what would be your advice to the United Kingdom as we see a rise in cases starting there?
I'll take the question. And as the first question, and my interpretation is correct, that you are asking whether or not there will be another spike in the new cases, I would say there's always possibilities. But however, according to what has been, notified, or what has been reported by the Chinese government, or even the local government, we understand it's not only in Wuhan, in Hubei, but also in other provinces in China, the newly diagnosed as well as the suspected cases, the number of the cases has been decreasingly sharply and persistently. And another evidence is that when we had the chance to visit a lot of hospitals, designated hospitals, as well as the non-designated hospitals, and almost all our colleagues that told us that they have vacancies, they have the empty beds, more and more empty beds after discharging those patients who recovered from the illness. And so according to my own judgment, that it is true that we have fewer and fewer patients even in Wuhan and in Hubei provinces. And as you second question, what is it? Okay. Any suggestion for United Kingdom or other countries with increasing number of new cases? Again, plan. The key word is plan. And how many cases do you have? And what is the plan to cope with the disease or the patients, the laboratory confirmed cases, as well as the close contact? Where to keep the close contact? And how to identify the probable or the cases within the close contact? I think I do believe it's a very tough job, but it has to be done. And it has to be done not only by the healthcare workers, but also by the government. I'm talking about the government. It's not only the healthcare authorities only. It has to be other department, of the government has to be involved, such as the public security, such as the police, such as the transportation department or other department. They have to work together. And I think that's the only way to control the epidemic, not only in China, but also in other countries. Thank you.
Okay. Any more comments? No? Okay. Okay, last question, please. The gentleman in the middle area, the third line, yes. In the middle area, yes.
A question from China Daily. Considering the declining trend of new cases and the rising numbers of recovered patients in China as positive signs, what can China share with the world in terms of fighting the coronavirus? And currently, what can China do to help the international community to contain the epidemic? Thank you.
Well, thank you very much again for your question. And your question actually reminded me of a message sent to me by one of my classmates in high school earlier today, which was a quotation from a French novel named La Peste, or The Plague, by a French novelist whose name is Albert Camus, back in 1940s. And during the conversation or discussion with one of the journalists, the leading character in the novel, who is Dr. Lear, said, is nothing about heroism, but honesty. All that in my mind, the only approach, the only way, or the only weapon to fight against the plague is honesty, which can be defined as doing your job. Doing your job, might mean different things. From the government point of view, I should say to share the detailed information of the cases, of the newly identified cases, suspected cases to the general public, to educate the general public about the disease and how to prevent, and to coordinate or to organize all the resources, including human resources and all the other equipment, devices that are necessary for treating or preventing the disease. And doing your job means, at the physician point of view, is to try our best to make the correct diagnosis and to treat the patient in the correct way in order to save their lives. Doing your job at the general public point of view is to comply with the professional guidance as to stay at home, to self-quarantine if you are a close contact, to obey all the regulations and rules set by not only the government, but also the healthcare professionals in order to control the epidemic. And it is my belief that the combination of all efforts from all aspects is the key, is crucial to the successful control of the epidemic, not only in China, but also in the whole world. Thank you very much.
Okay.
Yeah, thank you for the question. Yes, I think that the Chinese clinicians have confidence that to share the latest clinical research data to international society. As all of us know that from the WHO blueprint priority antiviral therapeutics, the Chinese doctors are leading two of them. There are three of the priority. First is remdesivir. The second is lopinavir. And third is the monoclonal antibody to this new coronavirus. And I can tell you the story that the Chinese doctors are leading the top two priority antivirals. I believe that the whole international society, including WHO, is eager to know the results of the clinical trials in mainland China. And I can show you that the good news is that the first trial is lopinavir clinical trial is finished. And the Chinese doctors will share the new results with WHO and the international society as soon as possible. And another good news is that the remdesivir trials, yes, we have two remdesivir trials, remdesivir 1 and remdesivir 2. Remdesivir 1 will include population of the mild to moderate pneumonia cases. And the remdesivir 2 will enroll the severe and critical pneumonia cases. And it seems that both trials are going on successfully. And as soon as we have finished the trials, we are very happy, yes, to share the data with international society. I believe that the clinical trials is the great contribution of Chinese doctors to internationally. Thank you.
Okay.
Just a few words because the time limited, and thank you for the question. And Professor Du Bin and Cao Bin already mentioned the key point. I just add one, because big data share also is very important. Even the different kind of patients, limited the number. Give example like the pregnant woman in my field, and until now we gradually accumulate 100 cases, and then we can see the good news is the pregnant woman usually is the mild cases if without the complicated like pregnant hypertension. And the good news another is the neonatals SWOT is negative, so no evidence for the mother to baby vertical transmission, but also have a few neonatal infection is because the relative have infection and then close contaction, so also need to isolated the neonatal 2 weeks as for the safetiness. And so I believe more and more cases accumulate. We analyze the regulation, and more evidence can show how to treatment and also give the right recommendation, right suggestion for the patients. And we cooperation together should be when the fight successful.
Okay, lastly, Professor Li, please.
Yes, I think we face a situation similar as 70 years before. There are virus infections with no effective antiviral drugs now and without a vaccine. So the older method is very useful to keep a strict isolation when the community epidemic occurred. So you must set up the method to cut down the transmission. You must decrease the total number of patients, because if the number is too large, that means there are a lot of identical ill patients. That means you maybe have a higher mortality. And also if there are too many patients, I think maybe centralized management for this patient is useful, because you must keep the patient in your eye. You can make a close relationship, close observation of the patient, and you can pick up the severe or very severe patient and then to treat them. So that's my suggestion. Thank you.
Okay, great. Thanks again. Finally, I'd like to say that we need to be aware that the situation in China remains complicated. We will work relentlessly to consolidate current results. We are confident that we can and will win the fight. On the other hand, the coronavirus is now becoming a common challenge facing all mankind all around the world. While fighting the epidemic at home, China will continue to strengthen cooperation with the international community to jointly respond and play an active role in the global fight against the epidemic. Today, our 4 professors shared and introduced many professional and valuable advice. And thanks again to all of you to take your time to join us during your very intense work in Wuhan. And also take care of yourself. Thank you. Thanks, and thank you all. That's the end of the briefing. Thanks.